Contrary to cultural assumptions that men are stronger and sturdier, they actually die younger than women from heart disease, cancer, stroke, chronic lung disease, infections and diabetes. While men's chromosomes and hormones also make them take more risks in life and in turn lead them to an earlier grave. We're talking all about the state of men's health today on The Younger You.
I'm on top of the world, now I'm living. And the good just gets better, keeps on giving. Not even close to the end, it's just beginning. Life is getting lighter while the days are getting brighter, yeah. And it's so good, I won't even worry anymore. Took all my cares, still can kick them all out the door. Go on and try, come and tell me what you're waiting for. Move and keep them going till your life is overflowing, yeah.
Welcome to The Younger You. I'm wanting to delve into what we now know as the silent crisis of men's health and why men are so relaxed about their health when studies show that in theory men are the weaker race. But before we get to it, I want to introduce you to my panel. Here today, Dr. James Hoatling with our men's health expert. From the University of Utah Healthcare, Dr. Eric Schmidt, our resident mental expert, and my good friend and our ABC4 News anchor, Kim Fisher. Welcome to the show, guys.
Thanks for having us.
Okay. Men live 6 years less than women. Our men's health expert, why is that?
Essentially, and that's been borne out in multiple countries. You know, it's not just in the United States, but it's pretty much everywhere. It's a combination of things. The biggest is probably that most of the time men are about 20 or 30% less likely than women to actually seek care. So most men don't even have a primary care doctor and essentially don't see a physician until something is really, really wrong. They also, especially in the younger years, have much higher rates of death by, accident or injury.
Kim, as a woman, when you hear that, going to be married one day with kids yourself,
right.
That you will probably live longer than your husband.
It's totally understandable. It comes down to our society. Women are allowed to be vulnerable. Women are allowed to go seek that kind of care. Men, it's kind of a weakness, right? It's admitting, hey, I need some help. And our society kind of tells men, no, you have to be tough all the time.
What's stopping us? Because there's more information out there. What's stopping men mentally?
Because we were raised with a fantasy that health means not going to the doctor. So we were all raised with grandpas who said, hey, I'm as healthy as a horse and I haven't even been to the doctor in 20 years. So we internalize these messages that is health.
I think another big component of it is I think a lot of men are just really afraid of sort of ignorance is bliss, if you will. If I might go to the doctor, I might actually need a procedure and need different things. And I think the other big component of it is women are by nature of having kids and being plugged in with an obstetrician, are plugged in more to the healthcare. I'm a urologist, and it's actually the urologic issues that prompt most men to actually seek care in the first place.
But is it the woman in their life, whether it's mum, sister, girlfriend, wife, saying, you've got to get to the doctor, there's something wrong with you?
A lot of the time it is, and I would say most men tend to put things off until they're sort of in extremis or till the very end, and then they want to get it all dealt with right away.
Yeah.
Do you think it's got a lot to do with men's egos?
I think so. I think men typically have what we call a narcissistic defense. So if you have a problem with me, then you have a problem. So it looks like ego, but it's usually just a defense.
I think that's very true. I deal with a lot of infertile couples, and I think a lot of, when there's male factor fertility issues, I think it's something incredibly difficult for men and sort of gets right at the core of sort of what they're supposed to do. But I think you guys have hit the nail on the head. I think it's a vulnerability issue, and I do see that a lot of the men who do come in are brought in kicking and screaming often by their, usually it's their spouse.
We know as men that girls sit around and we assume that they're gossiping about each other and their husbands and their health and whatever it is that you all talk about. Are men not doing that as much as they should be?
The best example I can give you is sort of, on the male fertility side. It's not a rare condition. It's like 1 in 12 to 1 in 15 men has fertility issues, and yet it's something guys never ever talk about. But the flip side of that is women, I think, on the other hand, are much more comfortable engaging in that dialogue.
But do you think that dialogue scares the guys as well, like because you are so open?
I don't think it's necessarily the fear, and you guys can correct me if you're wrong, the fear of having that conversation with your significant other because she is more open with things. I think it's because we teach men that they are supposed to be the leaders, they are supposed to be the strong ones, and so they don't want to appear weak to their wives. They don't want to appear like this could be something with me. because I'm supposed to be your leader. I'm supposed to be, you know, head of the household.
And how men and women communicate are just tend to be different. So women tend to be more comfortable communicating in a much more intimate way, whereas men tend to share information, which is one of the reasons I think sports is so popular, is because we can talk a lot about sports. We're not really talking about what's going on for us.
Good football kick the other day, but hey, I can't produce a kid. I've got low testosterone.
Yeah.
That's sort of as hard to kick into that conversation.
Yeah.
And I think also taking a step back from it on a pragmatic issue, men often have historically had a hard time getting to the doctor, like in standard, you know, business hours, if you will. Like, I know one of the
That's
things
true.
we've done is
Gotcha.
we have clinics, you know, once a week that go till 8 at night, and those spots fill up very, very quickly.
Up next, I want to continue talking with my panel to find out which diseases are causing men to live shorter lives.
Like us on Facebook for updates on the show and how to join the Younger You conversation.
Welcome back to our discussion about men's health. I want to chat about some of the causes of poor health and fatality in males. I pose a question to you. Which disease do you think are affecting the male population the most?
There's really two, you know, major issues. You know, number one, you know, in men is prostate cancer. And there's been a recent reversal of, you know, we used to screen all men with a PSA test annually, and the U.S. Preventative Task Force actually changed their guidelines to not recommend that any longer. So a lot of urologists in our community think that we're going to see a big uptick in prostate cancer. And then the other issue is just cardiovascular disease. Men not going to the doctor and other things means that, you know, the high blood pressure that they have in their 30s and 40s never gets treated, and that turns into heart disease in their 50s, 60s, and 70s.
I was reading this study and I found it quite interesting that African American males have the lowest life expectancy rate. Why is that?
There are some pretty strong genetic determinants. We know that African American males have a lot higher rates of high blood pressure or hypertension. They also, when they get prostate cancer, which is one of the most common cancers in men, it tends to be much more aggressive. And then the other issue is just access to care.
Kim, being a news anchor, you hear lots of medical stuff that you're telling the audience on a daily basis. What do you feel is the common misunderstanding about men's health out there?
The studies that I've done and the direction I've gone with a lot of my work, I find that emotional intelligence has a little bit to do with it, which is kind of what I've touched on a couple of times. But I feel like our society has this dialogue with men and women where, again, like I said earlier, women, it's not a big deal to go to the doctor because, you know, we're allowed to show when we're vulnerable. We're allowed to show when we're upset or hurting. I feel like the dialogue for men is that you're supposed to be stoic, you're supposed to be strong, you're supposed to be manly, you're not supposed to be vulnerable. If you're not allowed to show any kind of emotion and you're just trapping it all in, man, that stress has to do something to your body. Agree?
In the therapy room, what I've discovered is that men have the same emotional well that women have.
Yeah.
But they tend to want to know, well, how do I suppress this? How do I mask it? And because I think that we've all touched on it, sometimes the showing, especially emotions like crying or stress or anxiety, are considered weak emotions, and we're just not supposed to have that.
And I think it's interesting, though. I think it's changing. I mean, I think a good example of this, there was a picture recently of an emergency room physician sort of kneeling down and crying outside the ER, and I think it was in LA, about a 19-year-old patient who he just lost that went viral and got all this. And I think that, you know, especially in surgery, like with what I do, you're taught and you learn to keep your emotions in check.
There's a difference between suppression, which is trying to hide it or not have it or pretend you don't have it, and emotional regulation.
Right.
So I mean, you can have an emotional uptick while you're in surgery, but you have to regulate that emotion for when there's an appropriate time.
21.2 million American men are without health insurance. You talk about these type of things all the time on the news. Why are men less likely to insure themselves, do you think?
Man, that's a really good question.
I don't quite get, because they are still the typical, when I say breadwinner of the family.
Well, again, it comes to when you think you don't need to go to the doctor all the time, or you say, I'm healthy, I don't need a doctor, I don't need insurance. And it's really funny because men will take more chances than women. But I think it does. It comes down to that, I don't need this because I'm healthy and I'm virile and, you know, gung-ho.
And I think generally, to speak in very broad brushstrokes here, I think that men aren't as, sometimes, especially when they're younger, aren't as good at like projecting into the future, you know, as women are, whereas they sort of say, okay, I'm fine right now, this is going to be how everything will always be, where I think women are a lot better at being pragmatic.
You know, there's one other thing. Women at a younger age have to start seeking help from an OBGYN. You know, we have to start getting our annual pap smears. We have to start getting our breast exams, depending on what we want to do with our family planning. So that's something that women have to do every single year that men don't necessarily have to. And so I think maybe that's part of the reason why women will seek that kind of thing, because you're like, if I need an OBGYN, I need this insurance.
And I think effectively what now is happening is on the urology side, the sort of shepherds of reproductive health, if you will, are basically realizing they're in a better position than anyone else to do the same
All right,
thing.
well, I took some of these questions and more to Man on the Street. Take a look.
Probably because they think they don't need to, and they're so busy they don't have time to make it happen, and it probably just don't want to.
From my experience, most men seem to think that they're supposed to be strong and that it shows a sign of weakness if they go to a doctor for some reason.
I think men think they have to be like just the center of like the family kind of thing, like for as a dad or something. Like they feel like going to the doctor shows that they are weak.
I think we're bullish. Our pride sometimes makes us think we can self-medicate ourselves or self-diagnose ourselves.
Well, I think just the basic research of living a high-stress life, as well as I think diet and intake, they're more apt to just not want to go to the doctor and be proactive, find out the things they need to do to become healthier and stronger.
We won't go to the doctor. It's that old-fashioned thing about women talk to each other. And I'm a retired police officer, and I work with a lot of youth. So one of the things that I used to do is sit down with a lot of the youth and tell them, hey guys, we got to start taking care of ourselves like women do.
After this short break, we're going to bring up the topic of men's mental health and the toll that it's played on the longevity of men's lives.
Closed captioning for the younger you is brought to you by Mindful Medical.
Welcome back. Well, I want to touch on a topic that's a little bit harder to talk about, and it's an extremely important matter. That is the topic of suicide in men in America. Suicide is the second leading cause of death in males 15 to 44. That's a pretty scary stat. Let's start with you, Eric.
Well, there's
Why?
a couple reasons for that. Just along with what we were talking about, they're a lot less likely to seek mental health counseling. So when they're getting really, really depressed, there's no mechanisms to help them get out of that depression. And the other simple fact is they tend to use more lethal means, guns, that sort of thing, to try to end their life.
Look, I feel uncomfortable even talking about it because I think it's a very drastic end to when a man or a woman feels that there's no other way. When men are coming in to have their health checkups, do you also analyse or have thoughts in your mind that you also need to go and have someone to talk to as well?
Yeah, absolutely. And we not infrequently refer people to, primary care physicians or psychiatrists, for, help with a number of issues. It's absolutely something that, comes up.
What would you say to a male friend who you think their life could be heading down this road?
Oh, I say it all the time. I've had several friends throughout my lifetime who have dealt with depression, and depression is it's a very different thing. And people want to say they want to be able to control that feeling, right? I should be strong enough to control this, but at the end of the day, if you're running into depression, you can't control that. That is a mental health issue, and I tell people, go seek help.
And I think the other big issue is a lot of men, even if they want to seek it, just don't know where to get it or how to get it, again, because they're often not plugged into the medical system. And we've discovered at the University of Utah that it's not that we have to increase more referrals to our clinic from other clinics, but that actually it's a whole new business that's out there because guys just historically don't see anyone.
Right.
Well, interesting fact here, men are more likely to become heavy drinkers, smokers and illicit drug users because they're not dealing with the issues on a daily basis. So this is I was going to say self-medicated, but you were saying the CDC said it's more prescription drugs as well?
That's the number one cause of death for men and women under the age of 45 now.
And heroin.
Heroin would
Which
be in
is
there.
a scary fact. I had no idea that was the case until we started doing the research, and I thought to myself, why is heroin?
Well, there's what we see, and we see this in Utah because we're on the heroin highway, is people start with opioids, even at a young age, so they rob mom and dad's cabinet and they start with opioids. And they realize for a moment, I mean, drugs and alcohol do something, they fuel our delusions. They help us believe for a few minutes that everything is okay. And that's very attractive if you're already struggling with something else. And then opioids like Lortab get really expensive on the street. Heroin's not that expensive. And so we see them move over to heroin.
Being in the media, now we often talk about this, about women and the pressures that society puts on them.
Yeah.
Do you think men are more and more feeling the pressure, and yet they don't want to admit to that pressure about being the better man, the better looking man, the more successful man?
Right. Yeah, I think it comes down to that pressure of leadership. I think it comes down to that pressure of being the breadwinner, of doing all of these things. And that can lead to the depression, which can lead to the drugs, which can lead to suicide.
If I'm the leader in my family, then that means I'm fairly alone in making decisions, if that's what I'm telling myself, which is usually not true. So that fantasy becomes really isolating, and then that leads to depression.
You know, if you've ever watched a duck go across the water, it looks like it's this really smooth thing, but underneath the water, it's like total chaos to sort of do that. And I think a lot of men are
Good
similar.
analogy.
Yeah,
I like that.
I think a lot of men are very similar in that they want everyone to look like they're just going across. It's easy. I mean, men will often downplay, oh, I don't work that hard, everything comes easily, everything, while they're, you know, working like crazy. And I think that creates this illusion that, you know, people who are really successful or really seem like they're balancing everything, generally that doesn't come without effort.
Right.
And I think men are much less willing to talk about that.
If you see that someone could be going down that road of suicide, what are some things that I could look at with some of my friends and go, you're going too far, I need to get you help?
I mean, I would say from the medical standpoint, anytime anybody actually has a plan, you know, to specifically think about, you know, ending their own life, or, you know, if anyone just, you can see them progressing and becoming more and more hopeless, I think just letting them know that you're there to talk to them about it. All you can do is make yourself available.
And I think the signs to look for is when people start to begin to say that their life is unbearable, maybe not worth living. I'd be doing you a favor by ending my life. But then
Do they say that?
Oh, yes. Everybody'd be better off if I weren't here. There's one way that people sometimes justify it.
If you see a friend whose personality is starting to change, they're not as fun as they used to be, they start to isolate themselves. Those are things you want to look out for, because that can kind of tell you someone's going down the road of depression.
I took those questions to men on the street as well. Take a look.
In high school, I've known a few that have committed suicide, and I'm very well aware of it.
I didn't know that that was the case, and I think that's tragic. It's sad to hear that something that could be prevented is such a high death toll.
Well, we're going to take a short break, but when we come back, we're going to ask the interesting question. Who is the stronger sex, males or females? And I'm not going to punch you up. Back up at the short break. Be sure to head over to theyounger.you.tv to stay up to date with all things Younger You. While men have been viewed in many cultures across the globe as the dominant sex for years, but who really is the stronger sex? Even before birth, male fetuses have a far greater risk of miscarriage and stillbirths and higher death rate if born premature. Men are more likely to die from murder and accidents than women are. Men account for 92% of all workplace deaths, are also 3 times more likely to have Tourette's syndrome, 16 times more likely to be colourblind, and suffer hearing loss at twice the rate of women. We're weak. When I'm reading that, I'm thinking to myself, it sounds weak in the stereotypical way.
Right.
Let me say that.
Yeah, I would agree with that. I just keep coming back to the same thing, which is that vulnerability that women are allowed that men are not. And I just feel like in relationships, in life in general, I don't know.
I think that's a component of it. I also think there's a very strong evolutionary sort of component to it in the terms
What do you mean?
Well, just the metabolic cost of reproduction for women is much, much higher than it is for men. I mean, men have to produce sperm, you know, find a partner. Women have to, you know, carry the baby for 9 months, which means biologically, Mother Nature, if you will, has had to come up with a lot of other protections there, because from a species standpoint, as long as the man can actually produce sperm and other things, then they're okay.
Here's an interesting question from a viewer. If men and women, okay, are to live in the same lives, as in eat same food, exercise the same, treat their bodies the same, do you think they will still have similar health concerns, or do you think males' bodies are just simply susceptible to disease and shorter lives?
I think for reasons we don't totally understand, but are beginning to understand, I think if you could do that experiment, which obviously you couldn't, you would see that women would still live longer. And I mean, another thing to get back to more of a societal view is there's also very good data that unpartnered men don't live as long as men who are partnered, but it's the opposite for women. Like women who are married don't live as long as women who are single.
Yeah.
You said off camera a statement about gay men are more open and more susceptible to be talking about their health. What was that study?
So that was a study that was done by Goffman. He's a marriage and family guru, really, and he says that gay relationships are about 200 years ahead of heterosexual relationships because they tend to be more willing to accept where the other person is, and there's a lot more shared experience. So there's a lot less judgment, a lot less competition. Than in a heterosexual.
You're obviously not gay, Dale. There's a lot of competition. There's a lot of judgment.
And a question for you: How
You know what
much
I'm
of
saying.
I know what you're saying.
how much of that also has to do with those men are at a level playing field, if
Yeah.
you will? They see
Good
each other
point.
as equals versus men and women. In the stereotypical sense, do not.
Well, I think some of the things that he actually cites when I'm talking about judgment is less judgment maybe with one another. But if you admit to me that you have a crush on Hugh Jackman, then somehow that creates all kinds of anxiety for me.
Right.
In gay relationships, what he was seeing is if I admit that I have a crush on Hugh Jackman, my partner would say, well, who doesn't?
Right.
There would be no anxiety there. They wouldn't see that, oh, well, I need to have my body look like the Wolverine in order to remain attractive to my spouse.
Yeah.
We're sitting here talking, Kim, about being more open, being in touch with themselves, getting to the doctor without the woman telling you, be in touch with our feelings emotionally, physically. Does that sound as sexy as the bloke that sits out the back and chops the wood and picks you up on the Friday night? Do you see what I'm saying?
I personally don't think a man being in touch with more emotion is not an attractive thing. I think that if my spouse can look at me and say, I had a rough day and I'm just really emotionally drained, or if he says, I was really upset by this, or this really hurt my feelings, that's just being open and allowing us to communicate better. I don't think, I'm not your stereotypical.
And that's why I ask you that, because I sit here listening to Kim say those things that she wouldn't mind if her partner was like that.
Well, the thing is I can tell you what the studies show, that confidence is what's initially sexy.
Yes, absolutely.
So men appearing confidence. And one thing that I've learned, strangely enough, are those people, those men who are willing to be more vulnerable, introspective, take emotional risks inside of themselves, are more confident because they kind of know who they are. Women are much more satisfied in marriages where their spouse is more emotionally open and has more emotional intelligence.
Great insight on every different level. I really appreciate you guys coming in. Overall, men have more problems to worry about in mental and physical health, and also in the dangers of accidental injury and death. Becoming aware of these issues is the first step in taking initiative in your personal health. Health, diet and exercise could help save your own life. For more information about the show, please visit our website at theyoungeryou.tv, and I'll see you next week.
Next week on The Younger You, we are going to be picking our final contestants for the Younger You 12-week challenge and starting their journey to get into shape. The Younger You set provided by Madison McCord Interiors.